Hi, my name is Jessica and I'm a social worker, and I'm here to talk to you about the volunteer opportunity in the mobile clinic for all social work students. So a little bit about me, my name is Jessica Brierton. I am a hospital social worker at the University of Iowa Hospital. I got my bachelor's and master's at Iowa, and at the hospital I do a lot of programming around LGBTQ healthcare, and I run a training opportunity around that. And then last year I started the mobile clinic volunteer opportunity for social work students as well. In the mobile clinic, so if you're not already familiar, it's mostly entirely student run and it's interdisciplinary, so there are students from different backgrounds, and it's centered around communities that have barriers to care such as insurance and transportation, and it is focused on community health, and they partner with community leaders and run clinics in community buildings to help provide adequate care. And some of the locations include Columbus Junction, West Liberty, several in Iowa City, the newest being Inside Out Reentry. So you can see we work with a lot of different populations. So depending on what your interest may already be, there's a little bit for everybody, I think. And what we do is very unique and I think is very good for learning opportunities for students. And then it's also a really good service that we can provide patients as well. So we complete psychosocial assessments for our patients, and then we help provide information for community resources. We help ask a couple questions to help determine if patients might be eligible for Medicaid, and then we will provide a Medicaid application or let them know how to complete the application. And then we complete social work documentation, which for a lot of students is the first time they've completed that, or maybe it's just different than what they're doing in their practicum, so it can be a really good experience as well. And of course, these are some of the models that we draw from in the healthcare setting and then also in the mobile clinics. Every patient's different, so the way we use these are varying, but it's just very interesting that we can kind of connect how what you're learning in the classroom applies to what we're doing in the clinics. So if you sound like this might be interesting, something you might want to be a part of, just shoot me an email is the first step, and then I will follow up by asking for an updated resume, asking a couple questions to make sure it's a good fit. And then after that, we will have about 1 hour training. So we can go over what you can expect from me, what I expect from you, kind of a crash course into medical social work in an abridged way. And then after that, we can sign up for in-person clinics, which is face-to-face, and in the orientation we'll talk about some safety precautions, but the goal is to make sure that you're safe and that patients are safe, which is a top priority. So if you have any questions about that, you can also send that to me if that is something you're specifically concerned about. But otherwise, I know it's very stressful in these COVID times, but we're continuing to serve in the clinics. But if you have any questions, like I said, please send me an email, and I hope that you are as interested in the clinics as I am. So again, just shoot me an email anytime. I'm hoping to get students started in the clinic as early as probably September. All right, thanks so much. Have a great year.